Hi, everybody. Welcome to Be Empowered, the podcast. This is a podcast where we dive into the realities of healthcare and entrepreneurship. We offer our opinion, unfiltered, unapologetic, and always with a dose of empowerment. We're here to amplify voices, yours and ours, challenge the status quo, and explore what it truly means to thrive. So let's get into it. I'm Dr. Santoshi Bilakota.
I'm Dr. Shala Mokbel.
And today we're going to be doing our part two of AI in medicine. During our first part, we talked a little bit about the evolution of medical tools over the past 50 years. We've had so much evolution in terms of going from paper charts to EHR, uh, from having physical images to now all being electronic. That the technology itself is not new, but AI is promising some new and different things. So we talked a little bit about what the different AIs are in medicine, the benefits, the risks, and the challenges. And we also talked a little bit about what we think will happen to the doctor patient relationship with AI. This episode, we're going to focus a little bit more on looking ahead to the future, like what we anticipate will happen with AI in the next 5 to 10 years. And more importantly, what that means for physician compensation, which I think we're all interested in. So, Shala, I'll let you go first. What are your predictions for the future of AI in medicine in the next 5 to 10 years, you think?
I would say the next 5 years will be promising. I think it will be like a collaborative care model. Clinicians will rely on AI, but also will use their clinical judgments and their skills where AI will help physicians. 10 years mark, I'm not too sure. I'm a little bit more pessimistic, I would say. I think a lot of the human aspects of physicians will be lost, and future compensation landscape will not be as good for physicians.
I mean, I 100% agree with you to a point where I'm like, will I be here doing this for the next 10 years? I don't know if I want to be, because I think initially it's going to be good. I think initially AI will do a lot of stuff for us, make our jobs a lot easier. But I think at some point it'll plateau and probably go downhill. And I say that because look at Epic and electronic health records. I think when it first was introduced, it was great. It made things a lot easier. You can access patient records from other hospitals using care everywhere. It was more integrative, like clinic and inpatient didn't have two separate EMRs. It was all collaborative. So it was great. But I think as Epic and other EHRs advanced, it's almost like the documentation and the administrative tasks got burdening, like to a point where I think we're spending more time with documentation than we are with patients, as we've said before. So I think the initial advancements were great and helpful, but now it's to a point where I'm like, is this even helpful anymore? Like, do I really need this many alerts? Like you said, do I need an alert that the sodium is like 1 point off? Should patients be able to send me so many epic my chart messages? Should staff be able to send me epic secure chats when I'm not working? It's insane. It went all the way from being nothing to just being overwhelming very quickly. So I agree. I think with AI, within the first 5 years, it's going to be great. It's going to be collaborative. It's going to make things easier for us. Um, and I think after that, once it gets more advanced and used more readily, I think there's going to be a push for us as physicians to do a lot more with it, see more patients, because I can see the hospital administrator saying, well, now you have three NPs working with you and AI. Why cap patients? Why don't you see 50, 60 patients a day, even as a specialist? So I think that can happen. And unfortunately, I think what's also going to happen when they do that is, especially if AI is streamlining billing and coding, um, they're just going to bill and code more readily and maybe hurt the patient in terms of what they'll have to pay out of pocket for their insurances. So I don't know. I'm not so optimistic. Like we've already said, I think we already rely a lot on technology. There has to be some regulation somewhere, I think, to keep this from going kind of haywire.
There needs to be some regulations. Companies are rushing or competing to be the first one to develop the AI tools that will have the most profit. So I'm really worried, I'm worried about 10 years from now. And as you said, what's going to happen to that human doctor relationship? How would it even look like? Will it be like they go just see an AI for their follow-ups, for example, or an AI robot basically? Because I saw actually there was one AI system that was really, really helpful. So basically, the patient would call this number, and I tried it myself, and it was really, really fascinating that I would call this number, okay, and an AI assist basically it says, "Oh, I'm your physician's assistant AI," and would take all my history, interact with me, even empathetically. It seemed that I was talking to a human, really. What happened, to me? What is my complaint? And then put all of that into PDF form. It was really fascinating to me. It's really difficult to picture, but I can see a day where people will just go to their, AI person, and then that AI person will see them as a follow-up. And then if needed, then they can call a doctor. So that brings me to the question of, or the discussion about compensation. How do we think that AI will change the compensation landscape in medicine? In the past, for example, with introduction of EHRs, we had more workload, but there was no direct compensation gain. And we all know that physician compensation has remained sort of stagnant in the past a couple decades. Efficiency gains in some areas have not always translated into higher pay for physicians.
Yeah, I'd be curious to see if there's going to be any compensation for us to have to oversight AI. Or like, let's say you go and an AI sees your follow-up. Okay. And then what happens if again there's a poor patient outcome, or if the patient has questions, or how do you know if the AI is gonna counsel the patient the right way? Like I just don't I feel like it's just gonna create a lot of work for the patient, or not for the patient, I'm sorry. It's going to create a lot of work for the physician, where now we're signing off on APP notes and maybe AI notes. I mean, this might be too far into the future. I can't even wrap my mind around having just AI do patient follow-ups, but I've heard a lot of people talking about this, so I know it's not so far-fetched. But if that's what's happening, are physicians going to be expected to sign off on these charts? And are we supposed to review these charts on our own time? Like, is there any additional compensation? It's like when you're signing off on APP charts, no one gives you additional pay for that now. So what? You're going to see more patients, but are you really going to be able to bill more because the company or the hospital system, whatever that you work for, is going to have to justify paying for the AI now, right? So, do you get any amount of that money, or are they going to use it to fund continuously AI technology? I don't know. Maybe I'm pessimistic, but I have a feeling that this will probably not be so great for physician compensation overall. I mean, I can't see it benefiting physician compensation positively in any way. What do you think?
I think that it will result in institutional savings for sure. There will be cost reduction for admins, for example, or MAs when utilizing AI. But I don't think that means that savings will go to the physicians. I think that savings will just be more profit for the institutions,
It'll
right?
line the CEO pockets probably, like always, right?
Right. I mean, I can see that how AI probably will result in shorter hospital stays, better access for patients, because then if you have the tools that help you and see more patients, then it will overall there will be a healthcare savings, right? We've seen healthcare savings doesn't mean that physicians compensation is going to go up. So I don't think so. I agree with you, but also I think there will be a role for very specialized physicians, because you still need physicians to sign on AI notes, for example, to oversee the AI. So I think those roles will be more valuable because they're needed. But I think probably the junior roles will not be as valuable. So I think a junior physician or new grad, I don't think they will start with a high compensation.
I think personally the administrators will be replaced by AI. And we'll talk more about this, but I don't think physicians and nurses and APPs are going to be replaced by AI for many reasons.
Define
But I think
administrators. You want to
administrators
define?
are the people who do your credentialing, for instance, the people who do your billing and coding, the people who send you nasty emails about your encounters that you haven't closed out, or the documentation that you're late on. But more importantly, when you credential at a new hospital, how many like random people do you speak to? And you're like, what is your purpose? Because I feel like I'm doing everything here. You know, it's like, oh, can you do this, this, and this? Okay, so I've given you everything. Why can't you fill it out? Why am I doing it as well? Right. So I think the
The
administrative
middleman,
people,
right?
exactly. But I don't think that money is going to come to us if they get eliminated. Um, Maybe it will, but I think at the end of it, it'll probably just create more work for us because now we have to oversee what AI is doing when we're not there. And as we know, AI can hallucinate, so I'm wondering how many times it'll put a patient on something or give them some inappropriate counseling, and you're going back at the end of the day reviewing charts, and you're like, gosh, well, like what happened here? Now I have to call this patient back. I
Right.
know Epic right now is trying to incorporate AI that'll call patients with their lab results and kind of tell them what the abnormalities are. Um, which is interesting. In one way, I'm like, okay, well, that'll save me time, right? If a patient's like freaking out that their MCV is like a little low, instead of them messaging me, AI can talk to them about it. But on the other hand, I'm like, how do we know what it's going to tell them? Like what if
Yeah.
the patient's having real symptoms or real problems and it's like just reassuring them and they stay at home and get really sick? Like who takes responsibility for that? So I don't know. I am a little skeptical about it. I do think it'll allow doctors to see more patients. And we might be able to spend more quality time with patients because it's going to help us with documentation. And right now, with the physician shortage, I think that'll be helpful, especially in like rural areas. Um, with that said, I do think it create more work that is not directly related to patient care because now we're going to have to regulate and oversight and double check everything that it puts on paper. I don't know. I've talked to ChatGPT before and it's given me wrong information, and I wouldn't know if I went back and looked in all of it. Um, and then I also feel like sometimes when we rely on technology, we don't double check things. It happens to me, like for example, the GPS example you gave. What if you put something in and then you're just driving somewhere and then you realize, oh, I put in the wrong address because your brain wasn't thinking, like, why am I going in this direction when I'm supposed to be going in this direction? You just end up somewhere and you're like, oh, I put the wrong address in. That happens all the time with technology. Like how do we know that it's doing the right thing? And we might get so complacent that now we're overlooking mistakes that make us more legally liable for bad outcomes. I don't know. Those are just all my thoughts. Maybe I'm rambling, but that's what I think.
No, those are all great thoughts. The other thought that I have is equity concerns. For example, if AI is used in one area but not used in the other area, then you'll see a compensation differences. And I'm not sure what that compensation difference would look like. Probably just would
Hmm.
widen the gap between the two areas, but I'm not sure. Would the one that's AI heavy will have a higher compensation rate than those who don't, or vice versa? I can't tell. It's too soon to predict, I think.
And then, like the diagnostics that we talked about, like EEG reading or reading x rays or reading MRIs, because it's always like, oh, you might be replaced by AI. And I'm like, I don't know. Can it really do all of that? Like, are physicians going to be devalued because AI is picking up some of the slack? And I don't know. So, certain specialty tasks can be devalued. And that is something to potentially be concerned about as well.
In my area in intraoperative neuromonitoring, it's been years that this is not AI, but it's a tool or it's a company that basically automated the evoked potentials, which basically checking the nervous system. And, more likely than not, this automated system interferes with our signals and then causing more problems, during surgeries than not, because now when you have this automated system just constantly stimulating the nervous system, then we have to pause our signals, our stimulation. We're not monitoring the case, right, during that time. And then this automated system is not reliable enough, okay, to pick up on problems or issues during the surgery. So will it get better in the future? It might, it might, but I think there is a time in AI, the foreseeable future, I would say, is concerning until it gets to a point where it is reliable. Until it gets there, it's really concerning, and we really have to, as you said, verify everything that we read. In terms of compensation that we talk about, I would be worried because I mean, even now we see that a lot of these jobs or companies are hiring for physicians to annotate, right? Annotate for neurology, for radiology, for pathology, all these areas. And it's saying that the project is for a few months. I'm involved in a project. It's developing really, really fast, and I'm not sure that right now medicine is ready for it, is fully ready for it. The physicians are fully ready for this, or APPs are fully ready for this, or even nurses are fully ready for this. I don't think we are.
I think the way it is right now, we probably are not, but I do think there's going to be a slow uptake, like we said, and then it's going to eventually like accelerate and then maybe plateau and then plummet in terms of the offerings, the positive offerings in any case. One thing I think would be important also to mention that we didn't talk about is patient metrics. I mean, these a lot of these AI technologies are going to help with like predictive risk factors. Like, for example, if you come in with a TIA, what's your possibility of a stroke? XYZ. I'm sure the same thing can be extrapolated to cardiology and other specialists, or your likelihood of having a DVT, those types of things. Are those metrics going to be embedded now where we have to do it for every single person because it's available? And will we get dinged for not doing those metrics? Because I think if there's one thing that we've seen, our hospitals love metrics. So you have to meet certain metrics to get paid a certain amount. I think that can potentially affect what physicians are taking home. So now, again, there's additional work because you have to do these metric analysis for everybody. You also now are overseeing the AI tools in addition to the APPs, and double checking everything. And I don't think any of that is going to be properly concentrated. I think moving forward, there needs to be some kind of balance between oversight and also judgment, not just productivity based, because I think that's just going to be bad for everyone. And we need to really look at fair pay models when it comes to AI and its incorporation into our hospital systems. However, I don't know. I have a feeling the policymakers don't really care about those things. I think they really just want us to see more patients and be more productive. I mean, I don't think they care about compensation inequities, but as physicians, we really need to. And I think the best purpose or the best use of AI is when there's more of a hybrid model where the AI can handle some of the more routine care, and acts more as an assistant for the physician and helps them see patients while it takes care of more of the mundane tasks, while the clinicians are handling more of the complex things, and are available for human centered care. So I think that is probably the best use of AI. Do I think that's probably what's going to happen? No, I don't think so. I don't think so at all. I think we're just going to keep pushing physicians more and more into seeing more and more patients with the help of AI. And ultimately, I'm a little worried about where this will take us.
And I think that's why it's very important to join the advocacy groups and unions, professional groups to have a seat at the table for these policies, and regulations that are going to affect physicians, how AI is going to change clinical medicine for us. I think, unfortunately, physicians now are so overburdened by administrative tasks that not many of us have a lot of time for advocacy, but I think it's really, really important to be involved because AI can help us, but it can also hurt us in terms of the human doctor relationship that we all went to medicine for and the compensation. As you said, a hybrid model is the best model to have, where AI handles routines, and clinicians handle complex cases. So the clinicians will continue to have the human centered care, but we have to have the time for the human-centered care, right? There needs to be time for that. So really, I think there's a potential for sustained compensation. There's a potential for increased compensation. So we'll see.
Ultimately, that's what it comes down to. We will see. Like you said, it's a little too early for all of these predictions, and who knows? By the time AI really takes off, you and I might not be even be in clinical medicine anymore. So, but we'll still be patients, and I think I don't know. As a patient, I personally won't feel so comforted taking care of AI alone without physician oversight. Um, but we'll see. We'll see how things pan out.
I mean, I don't know, but I think changes are happening way faster than I would have expected. For example, even now when I go to my primary care physician, they're already using AI scribe, but the AI scribe is also putting even assessment and plan together. So it is much, much quicker than I thought. So I don't think, Santoshi, we're gonna be retiring before, you know,
One can hope.
before
One
this.
can
One can
hope
hope.
and dream. One can
Right.
hope and dream. But like, I don't know. Like, what do you really think that? Okay, so if AI is doing the scribing, it's coming up with assessment and plans, it's sending prescriptions, it's doing XYZ. So then, like, what's the purpose of the physician? Just to have someone that the patient can sue?
Yeah, I'm worried that I don't want to say this, but I hope that we're not just there, to take the medical legal
Listen,
responsibility.
I'm on social media and there's a lot of angry patients all the time, and they always go, "Oh, you're going to be replaced by AI." So not to me directly, but to other physicians who make more political videos. Oh, don't worry, you're going to be replaced by AI soon. And then some of the responses by doctors are, "Well, I hope so. I'm tired of doing this job." That's
I
not
know.
really a threat, but it's like, are we? I don't think that's going to happen. I just don't think that is, because I think, unfortunately, they will always need to be someone to absorb the medical legal risk. And so
Right.
I don't think we're going anywhere. And that might be a very, very pessimistic point of view. But I think it's steeped in reality. It's just what I've experienced. This job that used to be very, very prestigious. I mean, look what they've done to it. What's keeping them from just using AI to see everybody if it's doing all this stuff? So I don't know. It's scary.
Oh, yeah, I agree. I don't think we're going to go anywhere soon, but I'm worried about, again, that doctor-patient relationship. I think it's going to just get worse. And the compensation, I don't think it's going to get better, honestly. This is just my honest opinion. I think even now, it's like we have Amazon, providing healthcare services.
Yeah, quality is definitely going, and that's one thing we did not talk about, but I don't think we really need to talk about it. I think it's common knowledge that the quality is, of course, going to be affected.
Something has to give. You can't, when you decrease the time, okay, then automatically the quality drops. It's just a fact. You can't argue against that. So imagine you see 5 patients a day. Of course, you can provide the best quality care to that, and then you see 10 patients a day. You try to do that, and then you see 15, and then 20, and then 25. It's like, and the numbers just keeps going up. Of course, the quality will drop.
Is there's current subspecialty clinics that, even as a neurologist, want you to see 30 patients a day. That's what, 15 minutes per patient? Like what? You can't even get like a HPI in that time. I
Right.
mean, I think the quality is already in the gutter, so we'll see where this goes. I mean, I'm not very optimistic, but maybe they'll prove me wrong.
hopefully we'll have this podcast going for like 2 years from now, and then we'll record another episode on the progress, right? So
One
it's a
I have one final thing I'm gonna say before we close out is my father was visiting this weekend. We were talking a lot about how healthcare has changed, and we're from India. I mean, he knows my frustrations, even though we've been here for a very long time. And his point was, when I go to the doctor here, it's like I'll see 10 people, and like I'll talk to an iPad before I see a doctor for like 2 minutes, right? Whereas in India, like there is none of that. You go directly, you see the doctor, you give him money, he gives you the medicine. That's it. That's the end of the interaction. So much better for everybody else. So it's like all of these middlemen, and I think unfortunately AI is going to be a middleman too. I don't really know if it's going to be that beneficial to us.
One thing I was actually thinking about, we'll see how the landscape changes here with AI, but if that doctor human relationship is lost, and it is the reason why we came to medicine, maybe it's worth just practicing in another country where AI doesn't exist. And we do, then we will be able to really see our patients and spend the time that we want with our patients. And the compensation will be probably the same because then,
Yeah.
you don't have AI doing your work and then, the institution's telling you, no, oh, you have so much help and you don't need to be compensated X, Y, and Z. It is interesting to see how things are going to change in this country with AI and in other countries without AI. Thanks for tuning in to Be Empowered, the podcast. If you enjoyed this conversation, don't hesitate to subscribe, leave a review, and share with someone who needs to hear this. Stay strong, stay empowered, and we'll see you next time.